This is Moving Mad in Medicine, hosted by Monel.
Hi, I am Monel, a doctor trying to make sense of medicine without losing myself in the process. And this is Moving Mad in Medicine, a podcast about working in a system that demands excellence, but rarely offers softness. Here we talk about the pressure, the ambition, the doubt, the quiet anger, the chaos, the relationships, and the questions we are not trained to ask out loud. This podcast is honest and reflective. Sometimes it is funny, and other times it is uncomfortable. If you're in medicine and you've ever thought of leaving it or reshaping it, or maybe just surviving it, come with me and let's talk. Hi everybody, and welcome back to another episode of Moving Mad in Medicine. Today is a very special episode because we have special people in our midst. My bosses. What's that? Why are people laughing? Are people now our bosses?
Okay, watch us.
I know they want you now. No, now. I have 3 specialist doctors in my midst. Like, they are my seniors in the profession. 2 registrars and 1 senior registrar from various departments. And yes, I think people can take it off from there.
Okay, let me go first. So, hi everyone. My name is Osas, and I am a senior registrar in the Department of Pediatrics.
Hi. Welcome.
Thank you.
Okay, hi everyone. My name is Victor, and I'm a registrar in the Department of Internal Medicine.
Stuff.
Let me see. Let me get stuff with.
Okay, hi everybody. My name is Steven, and I'm a registrar in the Department of Obstetrics and Gynecology.
Welcome everybody. Thank you for being here. I'm glad we get to record this thing together. Before I start, how was your week?
Okay, my week was fine, but it was busy, right? So I had some extra curricular activities to attend to after work. So
Wow.
I was mostly getting home by like 10. So
Wow.
but it was a good week so far. Today is Friday.
Getting home by 10, and it was a good week. I wonder what a bad week looked like.
I won't get home at all.
How's your own week? How's it been so far?
So far, so good. My my week has always been busy. Right from January till now, I've always had busy weeks. Yes, crazy, right? Every day I come to work, and most of the time I have to leave late. And in fact, this week has been crazy on call, and you come to sit down in the morning. You come to sit down in the morning, and then people who have rested over the night will now start asking you questions that will just turn your brain. But we thank God.
Okay, how about you, Dr. Victor?
Okay, just by the name alone, Internal Medicine, I'm sure that speaks a lot of volume in terms of how busy someone's week could be. My week has been very, very crazy. Even in terms of the calls and consults from all the departments, because they just love us, and it's been really, really busy, I can say
So
for sure.
sorry.
But
Okay.
I thank God for the gift of life. We are still surviving, yes.
Well, I'm glad we got the time to record this because it was such a hassle to gather us in one place. My week has been fair, I can't really say so much. I've been stressed out, perpetually sleep deprived, but it's been fair. So today we'll be talking about the structure in medicine, which happens to be worldwide, probably in other universes as well. You don't, in medicine, there's this really big thing with seniority, the whole hierarchy thing, the ladders and the levels and all of that, things that categorize us, separate peasants and
Elites.
exactly. So, that's pretty much what we'll be talking about in this episode. And I think I will just scratch it by saying, when did it really hit you? When did you really realize that hierarchy in medicine was a big deal? When was your first ever experience of hierarchy in medicine?
All right. So let me go first. I think my first experience was in 400 level in school. Right. So I remember there's a picture I have in my head of a ward round, a particular ward round. It was surgery. It was a grand ward round, and you had everybody. So you had 400 level students, you had 600 level students, you had house officers, you had registrars, you had senior registrars, you had consultants, now junior consultants, then you have senior consultant, then you have professors. So yeah, that this professor taught these consultants.
Wow.
in school.
Yeah.
And this consultant taught this consultant. And then, so imagine a 400 level students, imagine how you would feel. You feel like a fly, in that place. You can't even talk. So, I mean, it was very clear that this was a hierarchical, structure that we're getting into. And, sometimes you just wonder, when will I get to that top?
Yeah.
When will I get there? How long will it take me to get there? So that was how, early I got to realize that 400 level.
Okay, cool.
Okay, well, for me, I think it was in my 5th year in medical school. And this thing where you put these consultants in high esteem, a professor for that matter, and then all of a sudden there is this meeting and one person just comes in, and that your prof that you think is there is just running after this person and be kneeling down for this person. Welcome sir, welcome sir. I be like,
Who is this
who
one?
is this one now? When you now hear the person's name and you say, okay, but what is this thing? They will now start giving you in medicine, there's this thing about history.
Yeah.
Even with our consultants too and their hierarchy, they will tell you the history of how, just like you said, this one taught this one, this one taught this one. So that's why you get to see how they regard this person, put this person in high esteem. You just know that, okay, this thing is real. It's serious. It's crazy. So even here too, that was the first time, but I've come to see this thing play out in real life scenarios. Sometimes you see one consultant put a plan, the one that seniors down will now come and
Very, very common.
put his own.
In fact, let me quickly interject. In fact, there's this thing where if we are both registrars and you resume a day before me, you are my senior.
Yes.
A day before you are my senior. So you have to respect that. You have to respect that.
And you can't counter the most likely plan. You just can't. Okay, for me, it was when I started my house job. That was just simply one of the, should I say, worst part of this whole program. During house job, like I said, you have your registrar, your senior registrar, consultant 1, consultant 2. I don't know if there's consultant 3. And then your professor. So, when we were in clinic one day, it was more like the consultant is there and you have to stay. You can't leave until the consultant will go first. You're still there. The senior registrar will go. You're still there. And then the registrar will go, you're still there. And sometimes you're even going home and then the next thing you're being called that, and there's this patient, I need you to go and check the blood pressures. You that is already tired, you understand? So the whole hierarchy of a thing is just crazy in this, should I say the Nigerian setting. I don't know for abroad, but then in Nigeria it's crazy.
Just like that, it can be the reverse. Sometimes the consultants will not come on time. You being a registrar or the house officer would have to wait. See, that consultant comes, even if it's 5 p.m., you are still there waiting for that consultant to come and do rounds. And after the rounds, you start doing your post. You stay behind until your post rounds.
Speaking of which, let me just put my own for what he just said as a house officer. There was a team I was in where you would have to do house officers pre-rounds. Now, if you don't do pre-rounds and they come and they see that there's no pre-rounds, hell will be let loose. But when you do that pre-round, they'll just swipe past it.
Just disregard the ones to tell you.
Don't give a hoot.
When you do it, it's not significant, but when you don't do it,
It's a problem.
And then there's the one where you do your pre-round, the reg will come, the reg will now join you, you now see the patients again. Senior reg will now come, will now see the patients again. Consultant will now come, you see the patients again. And when everybody has gone, you, the house officer, will be there.
Then post round.
Bro, you would have done like 4 to 5 rounds per day. Your leg would have burn.
For one patient.
Yeah.
It was for some days you are on call. And obviously you're not much. You're just maybe 1 or 2. And these people, all they do is just they come, do their rounds and go home. But you're on call. So after the rounds, you have to do post rounds and then you still stay for the call. So it's just not fair, if I must say. And I don't know why, they say always respect your elders, but the way they see this whole seniority of it is almost as though it gives them money. I don't even know how to put it, because some of them, they just see it as a way of oppressing their juniors.
Yes.
You understand? So that is just it.
it's almost like letting out your frustration on your juniors. Because, there's a lot of frustration in the profession. Yes.
Like literally, it's like you are passing down whatever has been let down onto you. So once the consultant gives you, you now look for the senior registrar will look for the junior registrar and pause it on, and then the reg now will now look for the house officer. and transfer the aggression. If they're medical students, house officers too go pour it on them. So
Do house officers really interact with med students like that?
sometimes they don't, but yeah, it depends. It depends.
Fair enough. You know, there's so many things we can scratch. I don't think we have enough time. This topic is so wide. But yeah, just this one time, let's talk about juniors. Now, I don't have a junior apart from med students, and I really don't interact with them as much, but I do enjoy their company. I like to teach, tell them, oh, this is what I could have done better in my time and whatnot. But besides that, for you people that are in the residency program, have you ever seen Shege from your junior before?
Yes, we see.
Give me your experience of where your junior showed Shege.
See, the sugar that my junior showed me, when especially when you need them, some of them they you know what this they call tissue factor. Have your junior ever tissued on you before? See, this time that we're on call, very busy call. In fact, that was the time I got punished because of the actions of my juniors. Wow. Yes, that was I just started residency newly, and we're on call this fateful day, and you know, things were supposed to get done, and after you say, please do this. Eventually, this person is nowhere to be found. You are not doing these things again, and you call, Alpha, where are you? Come, this person is nowhere, still does not come. Chief, okay, I go chop while they come. For chop, eating will take like 5 hours. Yes. And before the person comes, like, it's time, don't go. And it was late in the night, and my SR now came. I was like, Chief, you are not coordinating these people well. Meanwhile, I've been screaming things. I got punished because of this particular person, and that person gave me issues. In fact, I kept on complaining about that particular person over and over again. But eventually, I had to just find a way to work around it. If this person, and I've been complaining to the SR about it, and the SR couldn't do anything about it. So I had to find a way to work around this person and make do of whomever was there, so we could get work done easily. And that was how to manage.
So they punished you and did not punish the house officer?
No, the house officers too, they got the same punishment, but no, yes, they got their punishment.
Okay, since we're on this topic, how far do you think? Okay, how far have you ever gone trying to cover up for your junior?
I think I've gone. Well, I've not really had that opportunity where I have to do much in terms of covering for my juniors, because after that incident, I think most of the persons I've had to work with as juniors were exceptionally good individuals. They didn't give me that headache per se. So when there is need to get something done, they do it on time and they report back to me. In fact, it was so seamless at most of the time. So yeah, I didn't really have the opportunity where I had to cover for people.
That's nice. But because I've worked with you before, I think I should just chip in. I don't even think his response is objective. Because he does, for me, when I worked with him and speaking with people who have worked with him, he does a lot of these things, but he probably does not know when he's doing it. He shields you. Like, sometimes you'll be clicking, be like, give me that barrel. He will do the work. Like, he doesn't even notice he's doing it. But I think you do so much for your juniors. Given what I see or what I have seen, unless you have changed.
Well, if you want to put it that way, but I just feel like that's not really covering. Maybe if you say cover means that you've done something serious, extra.
Okay, fair enough.
Yes.
Fair enough. Okay, I think give me your experience of a really bad junior and how you've ever covered up for somebody before.
I think I would just say, basically, it's very difficult when you have a junior who is not interested in this whole medical, career of a thing. And then,
Why are you
no, that's the question I always ask. Like, so what's the reason for you doing the house job? You understand? Because it doesn't make sense. They are in the house job and you see them most likely selling their calls, or most likely they are nowhere to be found. Or most likely after the call, you're hearing things like, oh, they were not given some medication, some patients did not receive some certain things, or most likely you wrote a plan and then you went to sleep, hoping that, oh, this your house officer has actually carried out the plan, only for you to hear that, oh, who were the people that did call the next day? And you're also being punished because of that. Then in terms of covering for them, it's just basically you just have to get the work done, whether they are there or not, in as much as you're not helping them in terms of their progress. But in order to save yourself, you just have to do it. I've been in several situations where I had to give medications. I had to, get blood for tests. I had to do quite a lot. And that's just because of the house officer that was given to me as a then is someone that is not just interested. So that is just basically it.
Okay, what about you?
Okay, well, so I've had a couple of experiences of my juniors being negligent, but I think that I've been well in terms of the work, right? So, but I think that I've been a bit lucky to not have those that really are not interested. Perhaps maybe they just didn't know what to do. Maybe they're just starting, but it still goes down to when the work is not done, and because they tell you that house officers are under supervision, so whatever happens, it will still come back to you. Why did you not supervise them? You cannot just say, chief, I told them to do this, they didn't do it too. It's like, why don't you supervise them? Why didn't you? And then you also have your own work cut out for you. So sometimes it's frustrating, so you're doing rounds the next day and you are seeing that they did not give so and so drugs. And you're like, why did you not? They'd be like, the call was busy. And you're asking, how many patients did you have? They had like 2 admissions. So you're like, how is the call busy? In the end, because punishment is a thing that a lot of our seniors do. And, being someone who came into the system and observed such a thing, and, I didn't really like it. So it has never really been my style to punish, but of course, when some persons notice that, they might want to take you for granted. But, in the end, we just still have to cover, or sometimes we call them to come and do the work now, rather than punish, just come and do it now. At least let it be done, even if there's still some time. It's better than not doing it at all, pushing it to someone else. Because apart from getting work done, it is still, like you said, an avenue to learn. Because if you keep helping them to do the work, you are really not helping them. They won't learn. Someone that might never do, let's say, surgery again, might never do surgery posting again, just 3 months in your housemanship, and when you start working as an MO, you probably meet some minor surgical cases, and it is the experience from the surgery posting that you would apply. So if we keep intervening, we are not helping them. It might be that we're trying to save time, but we have to balance these things. Yeah. So yes, juniors can be frustrating.
That's true. It's a big deal in O&G where you have to learn these basic skills such as episiotomy and episography and what's it called, common drugs like administration of magnesium sulfate. It's a big deal for us there. And then you then have people who all in the name of I don't know how to do this, then
I'm not interested.
I'm not interested in O&G, so they are not putting their mind to it, and eventually they forget that they will go for youth service, and you get to meet pregnant women every day, the ones that will need episiotomy, the ones that will have perineal tear. How then do you go about repairing these things if you don't apply yourself and learn? Fortunately, I've had people who every time they'll tell me, Chief, please help, let me do this and guide me, and when you see those kind of persons, you are happy. You're happy to say, okay, come, let me show you, do it like this, do it like this. Things like MVAs is very common and it's life-saving procedures. So these are things that they need to learn. But it's so sad when you see the ones that are always playing truancy. Chief, I'm coming. Or Chief, those kind of things.
Sounding like typical seniors. Jesus.
Guide
The
life of a person, you have to guide the young ones.
But the truth is, whether you like it or not, these are the same people when you are old and sick are going to also be there to treat you.
Exactly.
So imagine if you are a woman and then most likely you are about to deliver and you have a tear, cervical tear, and that's the doctor that is supposed to suture you. You are finished.
I'm sorry to say this, but something happened. Something very, very tragic happened. There's a house officer we used to have who was like this. He was just not interested. I even did not realize he was going to practice. Guess who was the first victim of his wife?
Oh.
Yes, she died in childbirth. Yes, because he couldn't even identify that this woman needed to be referred.
Would have access to
a primary health center.
It's not really a bad thing to be there.
It's not a bad thing, but even
yes, you have so much access to specialists that you should be receiving tertiary level of care. I mean, it's just that you did not identify the need for it. That's sad.
And it was twin gestation. Jeez.
That's sad.
Most likely, maybe where they were staying is far from like town, and then they were progressing there in the health center.
Maybe.
But if you're there, then they try to most likely
you identify
take care of the emergency as well. Just try to refer and then go.
So well. That's
of
sad.
our school.
That's why whenever you get the ability to teach juniors, please put your heart to it. That's the ones that even if sometimes when you see the ones that are not willing, you will try you try all you can. You will try all you can, but when you just see them, you just know that this one, no matter what you do, no way.
So yeah, let's go to the seniors in the profession, right? So there's so many questions I could ask, but I would just say, what do you think is the thing they should understand better?
I think they should understand that times are changing and trends are also changing. The pattern of teaching and training is no longer how it used to be before. I think give 5 to 6 years back, how residents were being trained in certain departments. Yes, it was like military, and it wasn't really a palatable thing where you see your own fellow human being will humiliate you in front of everybody, ask you to stand up, face the wall, hold your ears, do this, do that.
What's education?
Yes,
Somebody's daddy.
it's crazy. Somebody's daddy, and then you see all those punishments where they give you 2 weeks, 2 weeks extra calls like that, back to back. You are being deprived of sleep and all. So I think they should realize that those times are changing, and those methods of training these days does not really achieve much. So they should have that mentality where they have to adapt, where they have to come to some sort of compromise in order to get the best out of this profession and train residents the way it should be.
For me, I would just simply start with, it's not everybody that is like that is crazy. Some are nice, some are very crazy. I'll just give like an experience. When I was in my house job, there's this consultant that actually punished me and gave me 1 month extension.
Oh, wow.
Now, the reason for the extension is so crazy that everybody who heard about it was just so angry. I was on call the night before, the next day. So, there were a lot of patients to give medication. So I didn't finish before 8. So he came for rounds early that day. So he was like, where is the house officer? I came, I was still on scrub. So just because I was on scrub, he called the chief resident that he should give me 1 month extension. Yeah. And that was it. Nobody could change it. Just because of scrub.
I'm almost tempted to ask who this person is and what center that could have been. That's not nice.
I'm sure if some people won't hear this that know about the situation, they know. Yes. Because they told me that's just who he is.
And you did the 1 month extension.
1 month extension. And the worst part, when I went for surgery one day like that, I'm just new to surgery. I don't really know much. So there was this sterile pack. They were about to do a surgery. So I was just about to. And then the next thing, it was like, I should get him I'd forgotten the instrument. So as I was about to put my hand, that's how the consultant was like, don't, how I knew this man is a devil. Next thing he was like, I'm lucky. And he's extended me more.
Trying to test you. Yes. Why? To what end?
Stopped you.
No, that's the consultant. No. Him is the professor.
Oh.
That's the consultant that now stops me. Yes.
Wow.
Then he now told me that I'm lucky he would have extended me more.
I don't like
Guy had it out.
So now you see the reason why.
I don't like difficult people. That was too petty of him.
These are seniors think that, they think that if they soft pedal, they are making you lazy. They feel that the training should be hard so that you come out well cooked. So they feel that, just like you said in the military, you put these people through hardship and, they have to endure. But, they put you through humiliation, both physical and emotional. I remember, I think I was a medical student or so. I remember a registrar in internal medicine presented the humiliation. He cried. Married man with children.
I've seen people cry.
They told him that they will call his wife, that his wife should not allow him this night.
Jesus.
Yes. I'm not even joking. I'm not even joking.
Anything.
That's humiliating. Why are you bringing his family matter into this?
Don't do that.
It's terrible. Imagine a grown man crying. It's not fair. So like you said, times are changing. These things should never have happened in the first place. But yes, it has happened. It happened in the past. But times have changed, and there are more than one way to teach people. You do not have to humiliate them. In fact, when someone is humiliated, they would even learn slower. You know, if you do not give them the enabling environment, they would keep making mistakes because they are always on edge. They're always second guessing themselves. So encouraging people, and even when they make mistakes, let them know that, okay, this is how it is, correcting them. I think it's just the best way to go, because they themselves they did not come to the profession knowing everything. Like we say, stuff is not congenital. So, I mean, you were once a novice. You were once a novice. I remember I went for resuscitation, and a house officer was assisting in the theater for a CS, and I think it was his first time. The senior registrar that he was assisting was really mean. It was just, guy, do this thing like this. Even the anesthetists were like, now, doc, now, it's his first time. You were once like him. I said, God forbid, I was never like him. I was,
They usually do what?
yeah, I was really angry that day. I almost wanted to speak to him, you know, but I was like, well, it's not my
I
department.
have a theory.
Yeah.
I feel like seniors who were really horrible as juniors, like horrible in the sense that they did not know their stuff, they're the ones who lord over their seniority when they get there. Because I think it's a way they get to feel good about themselves. These stuffed people, at least a good number of people that I know that are really kind and all of that, they know their onions. So you will now hear that consultant, he wrote part 1 7 times. So it's like they're trying to do something. Yes. So they're trying to do something to make themselves feel better. Like I've arrived.
I think you know this thing is most like PTSD. PTSD. You've been through a lot of trauma. And the only way you get to, I don't know, it's just something that happens by impulse, not that you want to do it. Some of them, that's the way I see it. It just tend to pour it. See, it's my own theory.
So in the end, we all need therapy in medicine.
If you ask there are most of consultants who are out there, most of the people who are out there have been through a lot of trauma in their lifetime. And if you look at it, that's why they will keep on doing this thing over and over and over again. Just call a psychiatrist and ask, let's do a proper evaluation.
All right, until you go for therapy.
It's true.
You know that you're not as alright as you think.
But just to put it out there, in as much as I feel like these things should change, I also feel like even as juniors or as people coming up, we should also learn to have that sense of responsibility. Yes, we have that sense of responsibility where we know that we're in a profession to save lives, and therefore we should take what we are doing seriously. If you go to a department for residency and you're going to train, you should have an idea that is what I've come to do. So you should apply yourself and do what is needed, even in your house job. When you get to apply yourself, I think you try to shield yourself away from some of these things, basically, and it doesn't.
You're actually respected.
Yeah, you're actually respected, and it doesn't get it doesn't get to that point where people will have to now start doing these things to you over and over again. But some of them will still do it. But you have to.
You will be immune.
Yes, exactly. You have to take yourself away from that place. So that's what I feel.
Okay, this has been really great. I would like to wrap up, but I just want to ask. This should be the last one. Is there any significant time where you ever had to stand up for yourself to a senior?
To a senior, has there ever been that time? Well, not really. I've never been the type of doctor where
Nice guy.
well, you should put it. If you put it that way. But basically, I believe that I've been able to apply myself to do what is needed to avoid being having talked to anyhow, where I have to now start responding.
Doing defensive medicine, right?
Of course. See, in this our environment, you have
just
to
have
to be defensive. You know what I do most of the times? If I'm on call, and I is also something that's very cool. If I'm on call, and there are critical cases in the ward, I always find a way to call my senior registrar. If his line is not going through, I send him a message. Let it be that he has seen. Yeah, there's proof that I reached out to him, because if the consultant asks you, who did you tell? And you say you told the senior registrar, and the senior registrar will now check his phone and say, you did not call me. You have proof that, okay, I called, you didn't go. I sent you a message. So the senior registrar has also that responsibility to also defend himself by also informing the consultant. That's the beauty of why, that's why I love where I am currently. If you call your consultant will come even in the middle of the night to come and do a case. Exactly. So yeah, you have to play that card. Yeah. Okay. Yeah.
Why? Yeah, internal medicine. Just leave internal medicine. Internal medicine is a very sad piece. Why I say so, you just simply because if you try to defend yourself, just like there was a period when I did call, there was this senior registrar. There's something during the call she did not document. And then when the consultant came around, she now started saying, but I told you people to write this thing. Why did you people do this? Why did you do this? But you did not write it. Now the consultant was now blaming us. And then I tried to defend myself. But at the end of the day, there are just some consultants that are biased. Yes. They always defend the SR over you. So those are some of the challenges. And yeah.
So you eventually did not successfully stand up for yourself?
That's all what I did. I defended myself, but then it didn't work.
But it did not work. It was unsuccessful. I'm so sorry. I'm so sorry about your experience. Dr. Osas.
Well, so I don't think I've really had any, during my residency here, I don't think I really had any time where I had to defend myself to my seniors. Although just a little bit different, something that happened when I went for outside posting. That was in 2021. And it wasn't even based on work, right? It was just a senior registrar who was trying to move mad. Right? Yeah. And I think that days later, I regretted not standing up. When someone gives you a word and you do not have a comeback, and then 5 days later you are beaten, and the comeback comes, and you're like, why didn't this thing come that time? Yeah. So I don't know. He was from surgery, and he was called to come past the central line for a patient that we had. So while they were just about to do that, the patient went into apneic attack and we had to resuscitate. So he and his registrar had to go one side and let us resuscitate. When we were done resuscitating, my SRO at the time asked me to go call him. I don't know this guy from anywhere. And I went there to tell him that my chief says he should come. He just went off on me. Like, who are you? Get out from here. I'm like, what's going on here? I was just confused, So when he was just ranting, shouting and all that, I was very quiet. I didn't even say anything. So his registrar was not cutting eye from me, because that one was my junior in school. Was not cutting eye from me that I should not react. I should just go. So I went to tell my SRO, this is what happened. My SRO said I should just let it be. But days later when I was thinking about it, I was like, if I had talked back at this guy, nothing would have happened, because I'm not in your AROD. You don't pay me salary from here. I'm on Supra, so, but it was just a very terrible reaction. It was a terrible thing. I don't know why he did that till today.
He must have been transferring aggression from somewhere.
So I regretted not standing up for myself in that, scenario. But when it comes to, work, maybe something I didn't do, or, I don't think I've ever had to be in the position where, I should defend myself or explain. Usually when something happens, maybe a misunderstanding, they call me. I think where I am, we are very respectful to each other. So they call me and ask when you explain and what you explain makes sense, they just, okay, let's try and do this thing. So yeah.
Okay. Let me just say, I've defended myself, but then it didn't work out. But I know someone who has defended himself. And the statement that came out of the consultant's mouth is, you are an untrainable resident. You understand? And I can tell you for sure, they frustrated him to the level where anytime he goes for exam, he doesn't pass. Reason being, they just write a letter to the examiners, and that's it. He's untrainable.
But my question is, if I am a consultant or something and I write a letter to another in fact, let me know, I cannot be that wicked. But let's say I'm an examiner and somebody from one state in Yola or somewhere writes a letter to me to fail someone. I will examine this person, see that the person is good. And I will really fail the person.
He said something about there's a professor that taught this other.
But wait, let's say I'm already a consultant. Wait, I'm already a consultant. What more can you do to me? Or like, I'm already a professor. What more can you do to me, even if you taught me?
No matter what. That's the reason why we are talking about hierarchy.
Yeah, they see that respect.
And the truth is that now take for instance, and some of them can be petty. Yes. Imagine you now, you say, okay, do this thing for me, and you send this candidate, fail this candidate, you didn't fail, you say, okay, let me pass him. That person will have that grudge in his mind, so that when next time your own candidate is going, they too will pay you back.
Yes, that's crazy.
Yes. That's the actually.
You could not tell us this thing when I was writing my echo.
And the other did Willow, Betty. Yes, actually. You fail until you come and beg.
Yes.
Yes, you will come and beg.
And that junior that defended himself was probably right. That was why he had the mind to defend himself. But how dare you challenge them? I tell you are wrong, and you claim that you are right. No, you're not ready. You're not ready. Finished. That's it.
You will never graduate from residence.
Just go and go. These are the things that we want to change.
True, I think I understand. I understand. Okay, so I think this should be the last. This should be the wrap. How do we, besides appealing to people's conscience and expecting that they'll be morally upright, how can we curb the toxicity in medicine?
Oh, it's difficult. I think basically it starts from us. You can't change most of the mindsets that have already been put there. But if you see that there is something that you don't like, something that needs changing, put yourself in the system and try to see how you can ensure that some of these things are put behind.
Let me say the reason why I say it's hard, because even as I'm like this now as a registrar, I can already see some senior registrars that are going to be toxic consultants. That's one. Two, the reason why, if I must be sincere, most of the consultants and most likely senior registrars and they are a bit nicer to the registrars and house officers, is because there are no more hands.
Yes.
You understand? I've seen a situation whereby we are doing money review where the consultants were just firing questions upon questions, and at some point the consultant was like, you should please be careful with your questions so that you will not just give up and go. You understand? So that's the reason why they are what's nice now. If not,
that's true. I remember my first time in starting residency. This experience, like you said, was true. My first call was hectic and terrible, and I almost, if you see me literally, I was pretty much exhausted, and I get to sit on a hot seat where you see consultants, 5, 6, 7 of them will start bombarding you question. Immediately they finish. The thing now, why they were able this now had to tone down. They asked, do you have primaries? I started without primaries. I did not. So exactly. They said, be careful though. This guy be jackpot. That okay, let me use my department as an example, right? So the gist out there is that my department is toxic. All over Nigeria. That's the gist out there, right?
Nationwide.
That's the gist out there. Right, but when
Please remind us of your special departments again.
if the audience do not know, let's leave it that way. All right. So I'm in pediatrics, right? And everybody says there are witches in pediatrics. You know, by design we have more women in pediatrics. And people say there are witches in pediatrics. In fact, we used to have these 3 witches. And all that. It reminds me of Macbeth, the 3 witches, right? So yes. So when I was doing housemanship, it wasn't as bad as I saw in school. I feel like teaching hospitals are more toxic than other centers, federal medical centers and all. And my experience during house job was surprisingly good. Pediatrics was my last posting, and it was good. I enjoyed it. I guess it must have played a role in my choosing pediatrics. All right. So even though it wasn't so bad as I thought it would, there were still a few persons who were kind of that toxic, right? But when I came in to do residency, after like maybe the first 2 years, some of those persons had left, and the department was very mild. There was one decision I took. I told myself that I was never going to punish any house officer by giving extra call. I made that decision, and I am glad to tell you, people of God, that in 6 years of residency, I've never given anybody extra.
The first non-toxic pediatrician.
No, I mean we are quite a number of us there, right? But I mean one of my consultants has never done that too. He has never done that, right? So I believe that there are other ways. I believe that there are other ways to correct without necessarily punishing, because we're all adults. We expect adults to have sense, although there are some adults that sense no follow, right? But I mean, I think it starts with you making that decision that this thing that I've experienced, I do not want to, give other people the experience. I do not want other people to suffer it. So it can be easy to be what you once despised. Before you become toxic, you wouldn't know it was the toxicity you endured that is now affecting you. But if you really make a conscious decision and you catch yourself when you're about to scream or insult
or punish. You hold yourself back and calm down, and with time. And one thing I used to do was when someone really messes up, in the ward, I call them and take them to the call room. Even if I want to quarrel with you, nobody has to hear it. Patient relatives do not have to hear it, because I know how I would feel if I am being washed in front of patient relatives and nurses. They would lose respect for me. I would lose confidence in myself. And some patient relatives have gone as far as, I don't want that doctor, because of what their seniors have done to them in their front. So, I understand that if I were in their position, this is how I would feel. So I try to not do that. So, I think so far, the point is, it starts with you making that decision that you don't want to replicate what you've gone through. Yes. So, then others can watch you and learn from your and learn from you. Yes. And before you know it, the whole place is just very conducive for everyone, for your juniors. Yeah.
I think the whole thing starts from the leadership. If you, as a head of department, for example, abolishes certain things, people will not be able to enforce it under your care, under your watch. So it actually starts from way up there. And like Stephen said, we should try to put ourselves in the system so that we can do what we wish we are seeing our seniors do. So I guess this is a call to everybody to get into residency, especially in pediatrics. Anywho, this has been a very nice conversation. I'm sure people had a good time. I'm glad I was able to unite the departments. Unfortunately, we didn't bring anybody from surgery, but don't worry. Thank you so much for being on the show. I appreciate you, and I hope that we can record any other time subsequently. And
this was nice. I think I would like to do this again. Yeah,
definitely.
This was a different topic.
Okay, sure, no problem. Please, if you're listening to this, try to subscribe, share, and give your feedback on the comments and wherever you find Moving Mad in Medicine. And take care. Keep moving mad. Bye.